Good afternoon, all. As Spencer said, my name is Nick DiGiulio. I'm the Special Agent in Charge for the United States Department of Health and Human Services, Office of Inspector General, Office of Investigations in Region 3. We cover Pennsylvania, Delaware, Maryland, Virginia, West Virginia, and the District of Columbia. So on behalf of the Office of Investigations, and I've been here for 20 years, so let me just say this. I've been doing this job for 20 years. I've seen many fraud schemes. I've seen many people get put in jail and pay money back because of violations of the False Claims Act. And I've seen the compliance programs grow exponentially, since I started back in the 80s. There really wasn't much of a healthcare compliance industry, and I've watched it grow and really go from 0 to 60, and now it looks like from 60 to 120 as we gear up for more people enrolling in the programs. And we've definitely seen the impact. I've seen it in my region, and we've seen it nationally, the impact of stronger compliance programs throughout the country, and we'll give you some examples of that. So we thank you for that, and thank you for making your compliance programs better, stronger, more proactive, and more responsive and cooperative with law enforcement. While I work with a dedicated group of criminal investigators whose goal is the swift prosecution of crooked healthcare providers, as everyone says, and we do appreciate, that there are honest healthcare providers out there working to deliver necessary high-quality services in an economical fashion. We just don't see too many of those every day. We deal with the bad ones, and we see them all the time, and we're making an impact and putting those people in jail and treating them the right way. Our goal at the Office of Investigations are to support criminal charges against providers who submit false claims or lies to the Medicare program, Medicaid programs for money. We're really looking for the lies, the blatant lies for the money. We support Civil False Claims Act cases. You saw the guy with the head in the sand just trying to avoid the rules, right? So when people just disregard our rules, submit false claims, and collect money, we use the Civil False Claims Act as a remedy there. And then at the end of the day, we will support administrative exclusion against providers, deserving providers and entities who violate our rules and who are deserving of the exclusion action. We vet all complaints that come into the office, whether they come in by people or whether they come in by data. We take our job very seriously. We don't want to go after the false positives. We want to make sure that when it comes to us from data, we look at the data. We make sure, we look at all angles of the data. We look for reasons why it could be a legitimate aberration or statistical aberration. There are certain procedures that stick out like sore thumbs, but there's a reason for it, and it's perfectly legitimate. So just because you hit every bell and whistle in the universe under a certain procedure code doesn't mean we're going to come in with our law enforcement gear and take everybody out. We are responsible with the way we handle data and investigations. Use common sense, and you've heard most of this morning, and I'll repeat much of what you heard, but use common sense to avoid prosecution. Be proactive in your compliance, understand all the rules relating to your businesses, making sure that everyone in the organization is fully trained and stays within the law. Keep good, accurate records of the training, and make sure you know everybody who's gotten their training sessions and who's been there, and keep good records of attendance. Make sure your medical records are real and not loaded with fabrications intended solely to gain insurance coverage for a product or a service or to increase a reimbursement rate. Keep the medical records real. Money has the power to distort medical judgment and honest business services. So don't disregard the anti-kickback statutes and related laws when you formulate your compliance programs. Look at the contracts. Unfortunately, at the Office of Investigations, we're going to continue to see cleverly worded contracts that are really just disguises for kickback violations. We see this every day, and we're going to continue to uncover those fraudulent contracts. Find problems before we do. We're not proud. We'll take them when you bring them to us. Fully investigate, fix, and disclose them. Be honest in the face of an audit. Don't fix the charts. Don't have chart-fixing parties. If your charts are deficient or if they don't exist, tell us. Our charts are deficient and they don't exist, right? And we'll take it from there. Don't withhold information or conceal facts. And remember that there are criminal statutes that address the obstruction of a federal audit, whether it's an HHS audit, a CMS audit, or any other audit that's out there by the government. If you become subject to an OIG investigation, fully comply with all subpoenas, don't destroy anything, don't hide anything, don't lie to investigators. If you are subpoenaed to appear before the grand jury, obviously tell the truth. Remember the criminal statutes associated with obstruction of justice, obstruction of criminal investigators, and lying to federal investigators and federal authorities. Nobody's perfect. If you find yourself involved in a scheme, cooperate with us. There are many examples of people who have cooperated with the government, even though they were involved in a scheme to defraud, that they got better deals and more leniency at the end. If we knock on your door with a search warrant or arrest warrant, we're not just doing it for fun. Don't resist, right? We have to conduct a fair investigation. We've already done that. We've gained approval from a prosecutor and approval from a judge, and we're obligated to proceed. So use common sense and be honest in the face of adversity. It only gets worse when you lie and conceal. I'm going to give you a quick example of, not to be negative, but I will give a quick example of a poor compliance habits from a provider that we saw in our region. CMS and the OI identified a top provider for billing the highest level E&M code, 99215, 60% of the time, right? We looked at it. We saw there were prior audits, 2 or 3 prior audits. Each time they said, these are not the most complex level office visits. These should be 1-2s or 1-1s at most, based on your medical record, So the provider, instead of what we believe falling into compliance, instead of 60%, they went up to 90% 99215s. But their charts look great. So every time the auditors went in to look at this stuff, this practice learned how to make the charts look legitimate. So they kind of turned it against us. And also, this provider was #1 in diagnostic testing over a period of time. So what happened was the patient started to complain, look, I'm still in the office waiting for this guy to see me. I'm only in his office for 2 or 3 minutes. Why am I being charged all of a sudden a higher rate most of the time? And why are these tests being ordered for all of us all the time the same way over and over again? So the patients complained. We interviewed the ultrasound technicians. They said, yep, we're scared to death. You know, we don't feel like we're trained properly to do the work. The equipment doesn't work half the time. I can't do a renal artery study. I can't even find a renal artery, yet an interpretation shows up the desk. They said, I found a renal artery, and it's 30%, 40%, 50% stenosed, right? And they were getting scared that this would generate additional unsafe medical procedures on more people. The office created false medical notes to prepare for the audits by Medicare. They hid and destroyed documents in response to our subpoenas. They considered burning down their practice, right? And we proceeded with a full investigation, did a search, and the physician obviously went to jail, was charged, and was excluded. One thing I'd like to say, when you do your audits, look at numbers definitely, look at medical charts, do the reviews, but don't forget to talk to people. That's what we do, right? Talk to the technicians. Make sure the equipment works properly. Look at the equipment records for certain testing. Make sure you can get the printouts. Make sure the doctor's paying for that expensive paper to print out the results so people can read it the right way. Talk to people. Don't just rely on medical reviews and desk reviews. Get out and talk to the people that are involved. Spencer asked me to talk about some recent fraud trends in our region. I'll discuss a couple briefly. Drug diversion. Right? I consider it a public health problem and a fraud problem. You know, the abuse of RX drugs is definitely an epidemic here in the U.S. The drugs are cleaner. They're manufactured with good manufacturing practices. They're inspected by the FDA. And you can get the same effect when you take them on the street as some of the illicit drugs. And it's creating addicts, and I have children, we all do, and it's getting in the hands of children, causing all other sorts of criminal enterprises and crimes on the street. Doctors are writing scripts for no legitimate medical purpose. They're selling the scripts. Beneficiaries of our programs are going to fill them. Medicare, Medicaid Part D, and Part B are paying for these claims. They turn them over to other people, runners who sell them on the street. In many instances, the beneficiaries are getting paid just to go into the pharmacy, fill the scripts, go into the doctor, go into the pharmacy, fill the scripts, and turn it over. They make money by participating in that scheme. Recent case in Philadelphia, Dr. Lawrence McKitty was sentenced to 7 years in prison for doing just that. This guy had been excluded twice, once for Medicaid fraud in Hawaii, once for defaulting on a HEAL loan, and then he came and set up a cash business in Philadelphia, got involved in this prescription drug scam, made a lot of money, but then found himself in jail. Transportation fraud. Not everyone who needs renal dialysis qualifies for a Medicare reimbursed ambulance trip. Beneficiaries are getting paid. We found a couple Craigslist articles out there recruiting beneficiaries. We'll pay you $200 if you have dialysis and are covered by Medicare or Medicaid and you want an ambulance ride, right on Craigslist. We're seeing unnecessarily ambulance trips for people who can easily ambulate. Just one Medicare patient, dialysis patient, transported 3 times a week for a year brings in tens of thousands of dollars to an ambulance company. And when it's unnecessary, that's a lot of money going out the door. Recent examples of indictments in Philadelphia, a couple of ambulance providers were recently indicted. One was an excluded provider. He was involved in a fraudulent ambulance company years ago, was excluded, was prosecuted, had a nominee, got back into the business, and we believe is operating, or had operated again, another ambulance company. Unnecessary cardiac stents. We're seeing it in the news here in Maryland. This is being kicked out by corporate compliance people at hospitals and for surgery groups and peer groups. We've seen it in Maryland, and a hospital just out in Pennsylvania just turned over a cardiologist who's accused of placing unnecessary cardiac stents. Risky invasive procedures, arguably, that weren't necessary and that were just for the money. ID theft, we heard Peter and Spencer talk about that a little bit. I can't tell you the stack of hotline complaints that are on my desk right now where people are calling Medicare beneficiaries claiming to be from a diabetic equipment company and asking to get medical provider numbers, dates of birth, and information from people. Either a company trying to steal business, gain business, or they're using it for credit card fraud, or they may be using it to set up one of these false fund providers that we're looking at. So we're seeing more examples of excluded providers getting back into the program. Help us keep the excluded providers out. Check the LEIE. Ask people when they come in, have you ever been excluded? Ask them, right? Because the LEIE, people change their names, dates of birth. Ask them and put that in your personnel files. Ask them if they've had any adverse actions related to healthcare fraud. These individuals have been excluded for a reason, so help us keep them out and from violating the terms. And then go ahead and check our fugitive website, right? And see if you see those people around. We don't want to hire any maybe of those people either. Protect information. I mean, we all know that protecting the integrity and privacy of patient information is not only vital to the medical care of a person, but it keeps blatant offensive fraud schemes from reoccurring and occurring. These criminals use every trick in the book to illegally gain patient and physician information, not just patient information, but physician information, to set up completely false front providers. They trick us into thinking they're legitimate, they know how to file clean claims, and they proceed to steal our money. The money is electronically put in the bank account, and then it's gone. It's cyberspace bank robbery is what it is, and it happens fast. So continue to make sure all your medical information is protected. CMS is keeping track of compromised beneficiaries and compromised patient lists, and we're using that. And we are exposing these schemes and catching people. We just arrested a group of people in one of our states in our region. Within 2 weeks, they set up about maybe 10 false companies and billed close to $5 million in Medicare claims. But we got them and arrested them even before they were paid, we hope and believe. So finally, if you uncover a fraud scheme within your practice or entity, report it to our hotline, 1-800-HHS-TIPS. Work through your departments and make the right choice of how you want to disclose it to either the OIG or the Department of Justice or through CMS. These actions will demonstrate your continued and full compliance and commitment to healthcare fraud and enforcement. and they will save our programs and protect our citizens from fraud, insufficient care, and harmful medical practices. Thank you very much.